Welcome, everybody. Welcome to our telephone town hall meeting. We had some people jumping right on. We really appreciate you getting on the call tonight. Congressman Lieu will be on with us in just a second. If you have a question of the Congressman or Dr. King or Dr. Eisenman, please press 0 on the keypad on your phone, and we'll get to your question as soon as we possibly can. So you press 0 for questions. We're also collecting email addresses tonight. If you want to provide us your email address so we can keep even more up to date with you, please by all means press 7 on the keypad on your phone, 7 for email updates, and we'll get we will get your email address and send you emails just once in a while. We won't send that email address to anybody else. Again, welcome to our telephone town hall meeting. If you have a question, please press 0. That's 0 on the keypad on your phone, 0 if you have a question, and press 7 on the keypad on your phone if you want to provide us your email address for email updates. Now, we want to get as many questions in as we can, so don't hesitate to press 0 if you wouldn't mind. We have a bunch of people on this call already, Congressman Lieu, so if you wouldn't mind, please take it away.
Thank you. First, I want to thank everyone who is on this call. I know these are very trying and challenging times. We have two terrific experts with us. I'm going to give you an update on what we're doing in Washington, D.C. And let me first start off with trying to explain the problem we're facing and why coronavirus is different than the flu. According to Dr. Fauci at the National Institutes of Health, it has a mortality rate that is about 10 times higher than the flu and likely more for people who are older Americans. In addition, it is very contagious. In fact, the president said a couple of days ago that it has record level-setting contagiousness. And it also can be spread by people who are not showing symptoms. And then finally, according to Dr. Fauci at NIH, about 15 to 20% of people who contract COVID-19, also known as coronavirus, get so sick they have to go to the hospital. And that can quickly overwhelm hospitals, which is what we're seeing in Italy. So that is the problem we're facing. And that's why governments, both from the federal government to state to county to local, have implemented measures to either recommend or have people engage in social distancing. And that is one of the best things we can do right now to try to slow the spread of coronavirus so that the hospitals can handle the patients going in. And if we can make it so there's not a huge spike, then we don't have hospitals having to make very difficult choices like they're doing in Italy on who they treat and who they can't treat. Now, Congress is also working on ways to try to mitigate this problem. So we already passed a bipartisan bill that's been signed into law that provided over $8.3 billion to combat coronavirus, including billions for a vaccine to attack and stop the virus so we can put it in you so your body can do that. It also has billions of dollars for additional small business loans at low interest. We just passed last week a second bill that provides significant benefits for Americans who are impacted by coronavirus, either because they get sick or they have to take care of someone who is sick or because they have to be home and because their kids are no longer going to school. And in terms of the paid emergency leave, that applies to small and medium-sized businesses. I wish we could have gotten it for everyone, but we couldn't get the other side of the aisle to agree to that. So it was basically applied to small and medium-sized businesses on the theory that many large businesses already do provide their paid leave. And we also had money in there that expanded unemployment insurance. It also provided money to the states. So that is now before the U.S. Senate. We are hoping the U.S. Senate passes it quickly. They haven't done so yet, but it looks like they will this week. And then we're going to be working on a third package, which will provide economic stimulus to many Americans who are going to be in trouble because of what's happening with the economy. The social distancing is causing multiple different sectors of the economy to start slowing down, and we need to make sure that we can have a cushion for people who are impacted by the economy. So that's what we're working on Capitol Hill. And now I'd like to introduce the two terrific guests we have. We have Dr. Jan King. She is the Regional Health Officer for West and South Los Angeles. And then we have Dr. David Eisenman. He is Director of the UCLA Fielding School of Public Health Center for Public Health and Disaster. And I am so thrilled they're here on this call, and I look forward to listening to your questions and having the experts answer any questions you may have.
Dr. King.
Yes. So good evening, and you're so right. We're going to really need to work together to address these issues and to overcome this current outbreak. So I want to thank you for this opportunity to provide the constituents with an update regarding our expanding coronavirus pandemic. So currently, there's over 100 countries that have reported in COVID-19 transmission. Locally here in Los Angeles County, COVID-19 is spreading rapidly. This is impacting our ability to work, educate our children, and socially interact with our friends and family. We've diagnosed 144 cases as of today here in Los Angeles County, and we've had one death. We've had an increase of 50 cases over the last 24 hours. You should expect that additional cases and potentially fatalities will be reported over the next several weeks. COVID-19 spreads person to person by droplets. So we all know that this virus doesn't have legs, it doesn't have arms, it doesn't have wings. And so it really needs your help to get into your body and make you sick. And that's why we're saying in the Department of Public Health, stay away from people who are coughing, stay away from people who are sneezing, wash your hands. Don't touch your eyes, your nose, and your mouth, because these are entry points where the virus can gain entry into your body. And currently what we're saying is stay home. Stay home so you do not come in contact with individuals who may be infected with COVID-19. So as public health practitioners, we have a challenge. We have a challenge because three of our most powerful public health tools we can't use. So one, vaccines. Vaccines are the most powerful public health prevention tool, but we do not have a vaccine against COVID-19 currently. Two, our traditional effective outbreak methodology includes case identification and tracing all persons who may have been exposed. So nCoV testing is really limited throughout the country as well as here in Los Angeles County. And without testing, we cannot identify cases, we can't isolate those cases, and we can't monitor closely those people who've been exposed. And then lastly, we don't have an antiviral medication to cure this infection. So we're without the tools that we usually use to decrease outbreaks and transmission. But given this, despite this, we still have hope. And what we're seeing is in other countries, aggressive and massive social distancing can work to slow coronavirus. So what we're asking the public to do is we're asking you to be extremely cautious and just assume that anyone you come in contact with may have COVID-19. Thus, as you've heard before, you need to social distance. You need to try to be 6 feet away from others while you're in public. You need to avoid crowds. You should telecommute if you can. You've heard about washing your hands and hand sanitizer. Well, washing your hands is better with water and soap, and then hand sanitizers if you don't have access to that. And then you should stay home, especially if you're over 65 or if you have a chronic disease such as diabetes, heart disease, or renal failure. So we're really stressing that you should not leave your home unless you're going for essential functions, such as buying groceries, getting medication, going to work, or school. So if you want additional information, you can also go to our website, Public Health, Los Angeles County Department of Public Health. There's lots of information regarding guidelines, what different organizations should do. And we have information in 13 different languages. So most of the community should be able to find information and have guidance to ensure that they stay healthy and we prevent disease. But as I said in the beginning, it really takes the whole community to come together to really resolve this issue and stop the transmission that we're seeing within COVID-19. Thank you.
Dr. Eisenman, go ahead, please.
Okay. Good evening, everybody, and thank you to Congressman Lieu for hosting this event. Really important to be speaking with my community neighbors. So, as Dr. Jan King just said, you know, the closing of restaurants and gyms and bars, working from home, the closing of the schools, and all these other what we called social distancing measures, which is a term I'm sure none of you had heard until very recently, are now really towards a single purpose, which is limiting the rapid and extreme spread of the COVID-19 cases so that they don't hit our hospitals like a tsunami. The social distancing reduces the number of people exposed at the same time to the virus. This means less people getting sick at the same time and less people getting seriously sick at the same time, such that they need a hospital or an ICU bed. And this means that doctors can give every patient, doctors and nurses and all healthcare workers, can give every patient the care they need instead of being forced to ration it, as we've seen in other countries such as Italy. We don't have to go the way of Italy. These extraordinary social distancing measures that we're now doing in Los Angeles and other parts of California have been shown to work. We know this to be true based on study after study in countries across the world and in studies from the United States. So I was asked to provide a few ideas about what kinds of recommendations I would like to see going into the future, just to say a few things. We've had amazing leadership from Congressman Lieu and from our local and state public health officers and emergency managers. Going forward, on a federal level, I want to see a national war effort, mobilizing our awesome industrial base to build ventilators and train respiratory therapists, along with producing all the other medical supplies we need. We really need to be thinking about this as a war and getting into that kind of industrial thinking. We need drive-through and at-home testing. I want us to do a better job communicating with young persons who do not appear to be doing the social distancing that's so importantly needed. And I want more national discussion about the fact that we might be doing social distancing for months, not just for 2 weeks. And we need to really start to think about this and how are we going to build our solidarity and our resilience. As someone in the New York Times points out tomorrow morning, after 9/11, we were able to come together socially and give each other hugs. We have a disaster, which I would say is now worse than 9/11, and we're now separated from each other. So, but nevertheless, it's #stay home. Keep up to date. It's a rapidly changing environment. Our public health officials and emergency management and local authorities are making day-by-day decisions based on the best possible evidence, but it changes rapidly. So keep up to date by going to the LA County public health websites and other official websites. Be careful of the misinformation and rumors that will float around on social network. We are all in this together. Los Angeles is resilient. We all have a part to play limiting spread and in maintaining our resilience. So on that note, I also want us to make sure we think about how we can protect the most vulnerable among ourselves. And lastly, I just want to end saying that while fear is infectious, so is kindness. Thank you.
And thank you. Congressman, we're about to take some questions in, but before I do that, I want to mention we're really trying to collect some more email addresses, so if you want to press 7 so we can keep you up to date on matters, by all means, press 7. We've got a bunch of operators on to help out get those email addresses so we can keep you up to date on matters one way or the other, so sorry about that phone. Anyway, let's take our first question. It's going to be, it just moved. We're going to take Donna. Donna, welcome to our telephone town hall meeting. Donna, go ahead with your question, please.
Okay. I was curious, if somebody walks by on the street in open air, or somebody walks through a shared hallway and somebody comes afterwards, how long the droplet potentially lasts in the air?
Dr. Eisenman or Dr. King, do any of you want to answer that?
I'm happy to take a stab at that. Outside, we don't worry about the droplets. The wind, first of all, the nature of a droplet is that it's heavier than air, and it drops to the ground within about 3 to 6 feet, which is why we say maintaining that 6 foot distance is so important. So if somebody coughs, they spread it about 6 feet at the most, and it drops down to the ground. Outside, you can go jogging, you can go walking. As long as no one is within 6 feet of you coughing, you're safe. Inside, that's probably the same thing. You don't have the advantage of wind, of course, but you know, as long as somebody's not within 6 feet of you, it's probably, and they don't cough within 6 feet of you, it's probably safe. There has been a report that's been making the rounds that the virus can be last in the air in what's called an aerosol, which is, aerosol is just like fog. Fog is an aerosol, which is just droplets of water that are hung in the air, and that the virus can act like an aerosol. That's based on a study that has not been peer reviewed, and the virus was turned into an aerosol in using a very artificial means, not necessarily the same as a cough. So we really need to be careful with that concern that in normal life, it's going to last in the air.
Thank you so much for that answer. Congressman, we're going to take Nancy next. Nancy, welcome to the call. Nancy, go ahead with your question, please.
Oh, yes. Hi. I'm just piggybacking on Mayor Garcetti's speech that he made. I think it was on Sunday night when he took his emergency move to, shut down bars and only take out restaurants and gyms, et cetera. And it occurred to me, and Dr. Fauci mentioned this regarding the hordes of people that were in a close concentration crowd, at close contact at the airport. And so many people are lining up behind Costco or Ralph's at wee hours in the morning, and that's not a really good social distancing practice. And they're hoarding things. And then there's a lot of young people that are running around thinking that they can just, they were even wanting to go to restaurants, and now they can't. And so I'm just wondering, short of lockdown, like they're doing in Italy, what do we do to prevent this kind of behavior? Because this is going to slow down the flattening of the curve, which is what we're aiming for.
Dr. King, you want to give some thoughts on that?
Sure, I can take that one. Sure. It's going to take us a minute for people in our population to change their behaviors. We have just issued a health officer order, a blanket order. This is something unusual. Usually we do it for individuals, but currently we're doing a blanket for the entire county. And this order, which is enforceable, states that various things. So one is that events and gatherings of 50 people or more prohibited until April 1st. That public and private events of gathering of 10 to 49 people can occur, but it needs to have certain limitations, such as you need to have access to hand washing, hand sanitizer, as well as there needs to be social distancing. And we also have orders that people can go out if they need to get essential items, such as food, medication, and what I was referring to earlier. So as time goes on, we will be enforcing this. So we have public health inspectors who will be enforcing some of these things regarding restaurants. So we heard a rumor that out in the valley, there's a restaurant that said they were going to defy this and they were going to continue to be open. So what we did was we sent our staff out there and we shut it down. So we will be actively working to shut down and change behavior over the next several days, 2 weeks, and to ensure that people are not hanging out, people are not congregating, and that people are practicing social distancing. The same thing for grocery stores. So We're working with different establishments to ensure that there is proper spacing as you enter into grocery stores and other places.
If I could just add on to that, in other countries that have been affected by COVID-19, they have had no problems with the supply chain for food. That's the same in the U.S. The supply chain continues to be strong, and so there is really no reason to go out and panic buy. Their shelves do get restocked, and what we want to make sure is that, again, people are maintaining 6 feet distance between each other. And I also understand the tremendous economic costs this is going to put on people, especially if you're working in a small business or a restaurant or a bar. You're basically going to have significant disruption to your paycheck, to your income. And it may seem all like an overreaction. I just want people to understand how exponential growth works, which is how this virus spreads. You're going to see not a lot of cases, and then it accelerates out of control. So, for example, at the beginning of this month, we had about 70 COVID-19 cases. As of today, we have over 5,000. By the end of this month, we have over 100,000 cases in the U.S. if there's no social distancing being done. And so that's why everyone's trying to prevent this virus from accelerating out of control. And at the very beginning, it does or could look like drastic action because people aren't seeing it, they're not experiencing it. But by the time people do see it and experience it, it is too late. So that's why we're taking the actions now.
Let's take another question if we could, please. Let's take Rudy. Rudy, welcome to the call. Rudy, go ahead with your question, please. Oh. Rudy, go ahead with your question, please. You're on. Rudy probably has herself on mute, so I'm going to read his question if I can. His question goes like this. From Rudy, President mentions every household gets $1,000. Also, how will the employees get paid? Do you have information? Congressman?
So the stimulus package that's currently being discussed on Capitol has a lot of different moving parts. I think there's lots of different proposals happening. The goal is to try to, number one, stimulate the economy. Number two, make sure that Americans who are hard hit by coronavirus are able to get a sustainable amount of support. And as Dr. Eisenman said, it's not just going to be for a few weeks. We need to think about this in terms of essentially a crisis until there is a vaccine. And a vaccine, when it's validated and can be generally available to the public, according to Dr. Fauci, is at least a year away still. And the reason that it's such a problem is because coronavirus is new, so no one has immunity. So if you were to stop social distancing measures, what happens is the virus then begins to grow and spread again. And so the choice is you either have to maintain social distancing for quite a while, or you have to go back to normal, in which case a lot of people are going to die because they get coronavirus and it spikes and it overwhelms hospitals. So it is not a very good choice that we're facing. But what Congress is trying to do is essentially saying, if we're going to do the social distancing for the many months that we need, how do we have sustainable support to Americans who are going to be very impacted by this? So it's still being discussed exactly what the package looks like, but I am pleased that both the administration, Democrats and Republicans all understand what the problem is, and we're trying to do what we can to get support out to the American people.
Another question comes from Claydine. Claydine, welcome to the call. Claydine, please go ahead with your question.
I am over 75. I'm diabetic and have other underlying conditions. I am also mobility impaired and use a wheelchair. Currently, some of the markets are opening maybe an hour early, which is around 7 o'clock or 9 o'clock in the morning, for disabled and elderly people to shop, because later on, once, the regular people come in, everything's going to be gone. Many of us depend on public transportation in some way to get around. We don't have a car, or in my case, I don't have any family members, to support me. And I have called many of those retailers who they know me, and I'm a regular person in there. They know I'm disabled. And I asked them, when it comes in, could you please hold a package of toilet tissue or paper towels for me? And they won't do it. And I asked them, have you gotten any other requests from disabled people to hold things for you? And they said no. But yet at the same time, they won't give me that accommodation.
Thank you for that question. So first thing I want to say is my staff will get your information. I know there are some organizations and groups that, based on what I read, is that they're volunteering to actually help deliver supplies and food to people who are disabled or can't get out of the house. So we'll see if we can put you in touch with some of those groups. And then, Dr. King, I don't know if you have any more thoughts on that issue.
Yeah, just a comment. So as we move forward with actually responding to this pandemic and the increasing numbers of cases here in Los Angeles, as well as trying to take care of our vulnerable population who need additional assistance, we're building this in. And so the Emergency Operations Center at EOC, one by one, we're addressing these sort of issues. There's other individuals who don't have housing, or there are people who we have to quarantine and isolate, but then they don't have food or they don't have money to buy food. And so we're working through these issues. And I definitely will be raising this issue with the Director of Public Health, Dr. Barbara Ferrer, as well as our EOC team to try to address issues such as this. I think it is a step in the right direction that elderly are allowed to go into the markets early, especially because they get to have access, but also there's additional social distancing if there's not as many people in the store. But you raise a really important issue that we need to address, and so I will take that back to my department.
Thank you for that. Let's take another question. It's Jordan. Jordan, welcome to the call. Jordan, please go ahead with your question.
Hi. Thank you for taking my question, Congressman Lieu. What is the reality of the availability of COVID-19 tests in our area, as well as the availability of the reagents necessary to process the tests?
Thank you for that question. Let me make a comment on it, and then I'll have Dr. King talk about it. I wrote a letter today to Vice President Pence, who is chair of the White House Coronavirus Task Force, and I asked what is the plan to get more of these chemical reagents out to the various states and how Congress can help him do that. So the issue is not only is there a limited availability of tests, but you also need certain chemical reagents to process the tests. And a lot of places either have run out or running short. And I'm trying to see what we can do to try to solve that issue. I don't know the exact numbers in LA County. Dr. King, do you want to talk about it?
Sure. So this is an amazing question, and this is so important to the effort that we have underway to try to beat back this epidemic. So as you know, initially CDC was the only lab that was testing or providing testing, so we had to send all of our tests and specimens to CDC. And then probably about 2 weeks ago, LA County, we began providing testing and performing the test, but it was very limited. We could probably do 50 a day. And then now there's additional private sector labs and hospitals who are currently performing the test, and there's others who are coming on board. So each day we're seeing more tests being performed, and unfortunately we're seeing more positive results. But as was stated, we're running out of reagents, running out of test kits, and then it's an issue of capacity of labs. So we definitely need support and it to be mobilized. So a lot of times people are saying it's going to increase, but we still are not testing as many people as we need to test. People are begging to be tested. And unfortunately, a lot of times we're targeting people who are severely ill, who are in the ICU, who are on mechanical ventilation. And we definitely need to expand greatly our ability to test. So any help that we can get in Washington will be greatly appreciated, because as I mentioned before, this is one of our biggest tools to be able to stop an outbreak. Oh, and then you said numbers. So currently in Los Angeles County, there's about 1,000 tests that have been performed, and 1,500 as of today. And then about 20% of those are being performed by the Department of Public Health, our public health lab, and then the rest are being performed in the private sector.
Thank you.
Let's take Sandra next if we can. Sandra, welcome to our call. Sandra, please go ahead with your question.
Hi there. Thank you for the town hall. This is in regards to small businesses, how you define what a small business is, and if there's government assistance to pay employees on paid leave due to the virus. How do they go about it? And is this really more for hourly employees, or does it extend to salary employees?
So thank you for your question. The way the bill works, if the Senate doesn't change it, is that for small and medium-sized businesses, their employee can take paid leave, and then the business will get a 100% tax credit. So the government essentially reimbursing the business through that method. I can have my staff follow up with you on the nitty-gritty details. There are sort of very specific provisions of the bill on, how to apply and this and that, and it also depends on what the Senate does with this bill. So I'll have my staff follow up with you, but that's basically the general framework of how that paid leave works.
Let's take it. We got a pile of questions in, so we're going to just keep trucking here. Let's take John next. John, welcome to our call. John, please go ahead with your question.
Hi, I just wanted to find out if you have an idea right now. I know it's early, but does it look like we are heading more towards South Korea or more towards Italy? And I understand that you're balancing the idea of, on the one hand, you don't want to minimize the threat and have people not do what you're asking them to do. So I guess I'm asking as best you can to give an honest answer, not considering what the political and social ramifications are. Just what are the facts?
Sure.
So thank you. Let me make a comment. I'll ask Dr. Eisenman if he has any additional thoughts. If you just look at math and just the numbers and just do a straight calculation, again, we had about 70 cases at the beginning of March. Right now we have over 5,000 cases. Based on regular exponential growth, if you follow the numbers, we'll hit over 100,000 cases by the end of this month. And then in a few months, we're just talking about millions of cases. That's without social distancing measures. Now, how effective they are going to be, honestly, we're not going to know for about 1 or 2 weeks because of their incubation period of this virus. And my sense is some regions, unfortunately, may have too many people who are infected already, such as New York. And so they really need to make sure that they have enough hospital capacity. Other regions, West Virginia only got their first known case today. So I think it might be partly regional. But Dr. Eisenman, do you have any additional thoughts?
Yes, I agree with everything you've said so far. And, from what data I've seen, it looks like we're more on track we're more on Italy's trajectory than we are on South Korea's trajectory. And as Congressman Lieu said, this has a lot to do with the rolling out of social distancing, which needs to be done early in order to really be effective. And there are places where it's being done aggressively, like of course, most aggressively in California, in Northern California, and of course, I would say aggressively in Los Angeles and in New York. But then we see pictures today of young people on spring break down on the beaches in Florida. So it's really, it just with that kind of different kind of approach in different places, that's not effective. And then the second thing is testing. South Korea was performing tens of thousands of tests a day, more than the United States was at this point. So unfortunately, we look to be more on Italy's trajectory. Now, that's early. We can change that. And even if we're on that trajectory now, that's not a fate. That just means that's the trajectory we are on right now. It doesn't have to stay that way. We can get ahead of this disease if we do the social distancing. And if we do get that out early before community spread really takes over, we can change that. So that's not that trajectory is not a fate that we have to follow. It's just a current trend.
Yeah.
Thank you.
I want to jump in and dovetail on this. South Korea is doing an amazing job, and I want to emphasize the issue of testing. Currently here, we're just testing the sickest, whereas in Korea, they were testing people who had minimum symptoms, sometimes just fever. Everyone got a test. And they were able to identify who's infected, isolate them, and then figure out who has been exposed. So as we move forward, expanding testing is going to be critical for us to really combat this epidemic.
Thank you.
Let's take Sheila next if we can. Sheila, welcome to the call. Sheila, please go ahead with your question.
Yeah, hi, and thank you for doing this. So my husband and I are both seniors. I have no comorbidity. He had a heart attack about 20 years ago, but he's perfect. We babysit my grandson, who's 2. He's in preschool 3 days a week with only 4 children in the class, and we take care of him 1 day a week. Can we continue to do that?
Dr. King, do you want to take a stab at that?
Sure. So people who are over 65, as well as people who have chronic diseases, do have worse potential outcomes if they become infected within COVID. So it's important that individuals who do have those 2 descriptions, quarantine themselves or just not be exposed if they don't need to be exposed to other individuals. And so I would say, in general, you should probably speak directly with your physician to talk over the exposure of your grandchild's presence in a daycare and work from there. But you need to, people who are above the age of 65 need to really seriously think about not being exposed to anyone because you don't know who may have COVID, and you want to protect yourself from that.
May I also add to that?
You bet.
Oh, yeah.
So hi. So I agree with Dr. King. I'm, these are the stories that break my heart, and they break all of our hearts. I think if it's possible, I just want to bring some other pieces of data to the decision making. The young cases, the cases that we've seen out of China that have been collected, there's a paper with about 1,300 cases of children 1 to 16 who had confirmed COVID-19, and about 5% of them who had been confirmed, meaning their blood tests showed that it was positive, were asymptomatic, had no symptoms. And so there's this real concern that the young can spread it and you can't detect that they're sick. And, anyone who has had a 2-year-old knows that they're just always sucking on hard objects and always have running noses and, and how can you ever know if they're really clean? So I do think that that's a real consideration. And if you know, it's not, you have to balance this against other issues, of course, with the family and the economics of it all. But from a pure risk point of view, I think it is risky to be with your grandchild right now.
Let's take Karen next if we can. Karen, welcome to the call. Karen, please go ahead with your question.
Hey, of course, I appreciate all that you guys are doing right now. Seriously, this is amazing that you're doing this. And I love all the questions thus far, and they've been answered fabulously. My question is literally about the Senate, among others. While the House passed this bill, which is, needs to be passed by the Senate, but hasn't been yet, Mitch McConnell is down fundraising in Kentucky with Brett Kavanaugh, drinking and partying and or going to die. And this really breaks my heart that the Senate can't come to their senses soon enough, or think it's a hoax, or thinking, and even the admin who
So Karen's basic question is, sorry about that, is when do you think that this is going to pass in the Senate?
So thank you for that question. The House, we did work all last week and late into the night Friday to pass the bill to help Americans impacted by coronavirus. I don't know why and cannot defend why the U.S. Senate took off for the weekend. And I still don't know why they haven't passed the bill yet. It's my hope that they will do it soon this week. I think there is, in fact, I'm just reading what I read, there is majority support for this bill. So I can't control the Senate. I do hope that they take this situation more seriously than they have been. I do expect it will be passed this week, so we'll see what happens.
Thank you for that. Let's take Bernie next. Bernie, welcome to the call. Bernie, go ahead with your question, please.
Yes. My question is, can COVID-19 be transmitted to bats, mice, rats, squirrels, coyotes? Is that possible?
Dr. Eisenman, you want to comment on that?
Not really, but I will try. I'm not a virologist, so I don't know if that can happen. I think that COVID-19 did jump from an animal source to humans. We think either bats or an animal called a pangolin, and that was done through either ingestion of food or some other infection in the markets. I'm not aware of viruses that have jumped back from humans into animals. Maybe Dr. King is. That's the best answer I can give.
Yeah, so as I stated, it's thought that the virus did jump from animals to humans and then now has been transmitted from humans to humans. And as you know, this is a new virus, and we are trying to learn as much as we can. There's very little data that shows that this virus can jump from humans back to animals. There was one article that I read that there was someone in Hong Kong who had the virus and their pet dog had it, but that has not been supported by additional data that has come out through CDC or through, other research institutions at this time. But, there's more that we're learning every single day. The dynamics are changing every single day. I wake up and things are different, and we have new information.
Thank you.
Go ahead. I'm sorry. I apologize. You had another comment.
No, I think we're done.
Oh, okay. Well, I thought I stepped on somebody. I apologize. Let's take Juliana next. Juliana, welcome to our call. Please go ahead with your question.
Yes. Thank you, Congressman Lieu. You helped me a lot last year on a Medicare issue, and I think this is great. Lots of things. My question for the experts, and you may or may not be able to answer this at this point, but maybe you can. I'm also an Italian citizen, and so this is serious, and you guys are telling us that. So whoever's out there at this meeting, it's real. And when you tell me that we're possibly going toward Italy on this issue, it's grave. My question is this. Every 4 or 5 days, I think there's a certain amount of days before somebody becomes symptomatic. 4 to 5 days, I believe, was I might not know that correctly, but whatever amount of time that you guys know that somebody, becomes awarely symptomatic, is that being looked at like as a percentage of increase? Like you said, there's like 100 more people or something, or 50% more. Is there a percentage that you guys are analyzing as far as the increase in cases, and then that then decide what civilly we're required to do? I'm just curious how that's going to work, because that's what happened in Italy, obviously.
Sure. Dr. King, what are you seeing in LA County?
Yeah, so that's valid. So first, the incubation period is the time between exposure and someone exhibiting symptoms. And what we state is the studies have shown that it's about 14 days is the period, the longest period that we're seeing. But most people get sick on the 5th day, so the 5 days after being exposed. Given that our data regarding testing and accessibility of testing is so poor, we can't really say. So initially, when it was just a public health lab that was doing testing, our numbers were increasing, doubling probably every 2 to 3 days. But now it's so much higher. But it's not a factor of the outbreak as much as it is a factor of just availability of testing. So it's probably the number of infections is probably much higher than what we're seeing in the numbers that we're counting, because we're not testing everyone at this time. So it's likely higher.
So one last ask, if you want to get on the email list so you can get updates about this and other matters from Congressman Lieu's office, please press 7 on the keypad on your phone, 7 on the keypad on your phone. We have a lot of operators standing by to get that email address. We just cleared the queue, so we're ready for you. Press 7 on the keypad on your phone. Let's take Susan next. Susan, welcome to the call. Susan, go ahead, please.
Good evening, everyone. This is fascinating, Ted. Congressman Lieu, this is Susan Nisman from Topanga. I wanted to specifically ask what discussions or inclusion has taken place in these various packages, particularly, I guess, maybe having to do, if it shows up in the third step of package stimulus, about, 1, suspending ICE. Has anything been done to suspend ICE in LA? We're looking at 800,000 families in LAOSD, and many of them are immigrants and undocumented, 80% plus, and they are fearful of getting tested, of reporting to doctors, and this will expand and heighten the curve and not lower it. Can you tell me what's going on with that? And also, is there inclusion and discussion about child care for those families who can no longer use service centers because the public health, LA County Public Health has deemed them to be not safe for bringing in children who parents need to work, et cetera. Thank you very much for having this town hall.
Thank you. I'll answer your first question. I'll have Dr. King comment on the second one. I think what you mean is suspend ICE raids, because ICE does a lot of different things. They do, for example, also deal with sex trafficking and drugs and other things. But in terms of suspending ICE raids, I would support that. I know that Senator Kamala Harris today sent a letter to ICE asking them to do just that. And if there is one way to try to keep a community and someone who should get tested from not going to get tested, it would be because of the threat of ICE raids. I think from a public health perspective, it is really dumb for ICE to continue to do that. So yes, that is something that at least the Democratic caucus is concerned about, and we can get you more updates on that, and hopefully ICE will listen to us. And then, Dr. King, do you want to talk about the child care issue regarding the
Yes,
county?
absolutely. Yeah, so as mentioned, our health officer order is written so that large gatherings will be prohibited, as well as other, there'll be stipulations regarding other gatherings as well. And we're emphasizing that individuals should not leave their house unless they are engaged in essential activities such as work, such as school, buying groceries, medical. But we consider child care an essential activity. So many of the individuals that we need desperately to keep life moving in Los Angeles as well as safe, such as healthcare workers, such as police, such as fire, as well as people stocking grocery stores, they need child care. And so that is one area that we're not shutting down. We're not shutting down the child care centers. And we are working directly with child care centers so that we can put in guidelines and procedures so that we are socially distancing the kids as much as we can. Kids need to be loved, they need to be cuddled, they need to, have interactions. But we believe that that is an essential activity and service that's being provided to the public.
Let's take Laura next if we can. Excuse me. Laura, welcome to our call. Laura, please go ahead with your question.
Oh, hey, sorry, I was on mute. I know we're talking a lot about the testing, and it seems to me, sorry, my dog, it seems to me that the only way that we're going to get this under control and really get this stopped is to have everybody tested and to have, drive-through testing centers that are not near the hospital or something like that. Do we have plans to have that going? And if we do, how far out are we from that scenario?
So thank you for that question. I'll talk about it sort of the federal level, and then maybe Dr. King can talk about what you're seeing at the county. Unfortunately, we in America were very slow to ramp up the testing. And, there'll be ample time after this crisis to sort of study why that happened and to place blame where it should be placed. But right now, we just have to work together and make sure we ramp up testing. I do know that everyone is very aware, both in administration as well as in Congress, that we need to significantly increase testing. That's going to take some time to do. And we do have more test kits than before, but definitely not enough. We're running out of chemical reagents. I know we're running out of other supplies like nasal swabs. So you had to have this, strange conversation, probably never in the history of the U.S. before, where the governor of California had to talk to Donald Trump about nasal swabs and getting a commitment to get nasal swabs, which we now have a commitment to do that. So that's good. So I think there is a ways to go in terms of testing, and that's one reason, unfortunately, we're trying to go to maximum social distancing. If you had a very large testing surveillance system, it's possible you could relax some of the social distancing. But until we do have that large testing system, we just have to be in the social distancing mode. And so if Dr. King wants to answer that, and if Dr. Eisenman has any thoughts.
Yeah, so I'll probably disconfirm what you're stating. We are engaged in planning for what everyone is referring to as drive-through testing, but it's actually drive-through specimen collection. So at the end of the drive-through, you don't get your results. You basically just go and get the specimen collected, but it's an easy and probably safer way of doing it instead of having people come into our clinics and healthcare facilities. So the Department of Public Health, as well as there's probably at least one private sector healthcare provider, has been thinking about this for 2 weeks, a week and a half, and there's discussion about, how we implement this. But as Congressman Lieu has stated, it's really about, the product, the reagents, the test kits, and then bringing up the lab to have that capacity. So a lab may be ready to start testing, and then they get the okay, but they have to go through a whole procedure to ensure that their lab has the capacity, has the skill to actually perform the test appropriately, and we're lacking that. So it's really the product, the reagents that we need to find and to get mobilized so that we can perform drive-through testing as well as just testing everywhere. We have clinics and hospitals that can't test or it's limited, and then we have a challenge with actually getting results back in a timely fashion as well, just because of this lack of process. So, yes, hopefully we can get to that. And then you asked how long. I would love to see it in a week. I'm not sure if it's going to happen that soon.
Let's take Cynthia next. Cynthia, welcome to our call. Cynthia, please go ahead.
Hi there. Thanks for having this town hall. I really appreciate it. I'm a makeup artist in film and television, and I'm in local 706 IATSE. And pretty much all production has been shut down. And I'm concerned because, not working for a few weeks, that's okay. I can deal with that. But if this is ongoing and it's months and months and months, I'm really worried about the whole money part of this. Of course, I'm just speaking for me right now, but I feel a lot of people are in this position when you're looking at long-term, the inability to do your job. Just wanted to know what we can look forward to in that area as far as any kind of programs or help.
Thank you very much for your question. I am working on a letter with Congressman Adam Schiff to Speaker Pelosi that for the next round of stimulus, we make sure that we capture as many Americans as we can who are impacted by coronavirus, including those in the entertainment industry. And my district does have a fair number of people who do work in the industry, and they work at, different kinds of positions and classifications and jobs. So we want to make sure that any stimulus can capture as many people as possible. And the next few months are going to be very difficult and challenging for our country, but I do believe working together we will prevail and get through this. Right now we're trying to do two things. One is to make sure that the hospitals and health providers have the resources they need. That's why we passed the first bill that's now law. Second was to make sure that a lot more people were able to get emergency paid leave, as well as unemployment insurance, as well as small business loans and others. And then the third is stimulus for Americans who essentially have lost their jobs and need to pay their bills. So that's what we're going to be working on. And the final shape of that, we don't know yet. But one of my priorities is make sure we capture as many possible Americans as we can, including those in the industry in which you work.
Thank you, Congressman. We're running out of time. Whether you press 0 or not and you still have a question or a statement, you can leave that message at the very end of this call. Leave us a voicemail. Leave us contact information if you want the office to get back with you, like name, email address, phone number, stuff like that. Congressman Lieu, please bring us to the finish line if you would.
Yeah. So let me first of all thank Dr. King and Dr. Eisenman for being on this call, for the information they provided, and for their work they're doing day in and day out to try to mitigate the spread of the coronavirus. We are in challenging times. They will unfortunately become more difficult, but I do think that as a country, we've gone through challenging times before. It's made us stronger afterwards, and together I think we can overcome this crisis. We just have to work together, be kind to one another, and know that we have very hardworking, diligent people who are working at all levels of government and the private sector and academia trying to solve this problem.
Good night, everyone.